Well, some parents and pediatricians are growing impatient, waiting for a COVID-19 vaccine for younger children. Joining us now, Medical Director of Singing River Pediatrics, Dr. Tyler Sexton. Dr. Sexton, thank you so much for joining us today. And, we didn't hear about this too much before in the last waves, but right now this is becoming a serious problem for children, and you're seeing it at Singing River.
Yeah, that's right, Karen. Thanks for having me on. You're right. This new variant has, mutated, and now it is affecting our pediatric population. We are seeing a lot more of these kids that are being admitted to the hospital, age ranging 16 and below. Most of the average symptoms that you're seeing are still going to be, compiled around the respiratory distress, pneumonias, bronchiolitises, things like that. There are still more severe cases, breakthrough cases that you're seeing requiring intubation and more aggressive high flow oxygens and things like that. Thankfully, still the vast majority still are able to be watched as outpatient, but we're definitely now, it is affecting pediatrics. Where back a year ago or so, one of the models I said, it's a blessing to be a child because COVID-19 didn't affect these kids as aggressively as it is, and that is now, changing.
And how many children are in the hospital right now? Do you know today?
So currently,
With COVID?
Currently between our three systems, we've got 5 kids that have positive COVID-19 that require inpatient. And we have quite a few of our infants that are testing positive because these COVID positive mamas are being affected, but they're asymptomatic and doing okay. So right now we have 5 in our care.
It's so distressing to see anyone fighting this, but certainly difficult to watch children going through this. What are you hearing about vaccines for those that are eligible anyway, for those over 12?
So I know this is a hot topic, and we're still going to, I recommend the vaccine. The one thing we can do that's critically important is to those that can get the vaccine that are 12 and up, you need to try to do so. You will see, there's a large study right now that the AAP and the CDC are running. Of course, I'm sure a lot of you guys are familiar with that are looking at these younger ages. I think in the next few months, you're going to see approval for a much younger age. And I will tell you on the air like this, as soon as that gets approved, my children will be the first ones, receiving that vaccine for protection. So, these vaccines, they do work. I know that there are breakthrough cases like any other vaccine, but I mean, these vaccines have a phenomenal effectiveness rate, and we are still seeing that if we get vaccinated, that these kids and these families are not getting as sick as they would without it. And so it is important right now for schools. I still believe that these schools need to stay open. Face-to-face learning is still critical for these kids, but we need to take the precautions we can by good hand washing, social distancing, and get these vaccines. The parents, the teachers, and those that are 12 and over need to get the vaccine to protect those that can't right now, and that's under that age until we get the approval.
All right, Dr. Tyler Sexton from Singing River Health System, thanks so much for joining us today, and take care.
Thank you.